Hi, it's Dr. Raffi Karamanoukian, and today we're looking at a scar revision for an earlobe keloid that's located behind the ear. The first step is for me to make surgical markings for my incision sites. I'm using a surgical marker to mark out where I'm going to make the incision and where I'm going to preserve the skin. A 15 blade is used to make sharp dissections to separate the keloid from the overlying skin. This process is known as enucleation, which is quite different than the normal keloid excision technique. I use this technique preferentially, and I've written a paper on it, and I believe that it's superior to any other type of keloid surgery because it minimizes deformity after the operation. People will note that the surgery is not very bloody. I'm using a little bit of numbing medication and the patient is awake. The keloid mass is a large glob of collagen and elastin, and you can see it's white in color because it's not very vascular. And here I'm separating it from the underlying subcutaneous tissue. The last important step is to reconstruct the ear so that he doesn't have a large aesthetic deformity after surgery. The earlobe is a very, very important aesthetic unit of the face, and we want to preserve the integrity of the contour of the earlobe so that it can look like the other ear. I'm using interrupted sutures, which have a lower likelihood of breaking down after surgery and during the recovery period. And these are being completed one by one. And in a minute or so, you'll see the final result, which is an earlobe that looks relatively normal. The healing process is about 2 to 3 weeks, where we have to make sure that the wound is kept clean and there's no extra tension on the wound. These are the final interrupted sutures. And the surgery is a complete success. I'm putting a tacking suture to minimize bleeding afterwards. You can see that there's no drains and minimal bleeding. The surgery is a complete success.